Hi, I'm Maxine Higham. I'm doing my placement 2, so this is video 2, physical examination of the full TPR. For this I'm going to use the ACPN sheet as a prompt list. Today we're going to be using Chloe. Chloe is an 8-year-old dachshund who's coming for a dew claw removal. So we're just going to do a TPR on her and check her over. So a distance exam of Chloe is seeing Chloe on the floor. She's even on all 4 feet. There's no sign of lameness. She seems bright, responsive, alert, pretty happy with herself. Her breathing, she's not panting, she seems to be breathing normally. Yep, she's quite alert and watching what's going on around her. Chloe, come on, sweetie. Even got a waggle and tail. We're just going to pop Chloe up on the table. Let's turn you around, sweetheart. Let's turn you around. We're going to start with Chloe. We're going to start at her head, and we're just going to check that everything's symmetrical. She's got bright eyes. There's no discharge. She's got a couple of little skin tags on her nose, but for her age it's expected. Her ears are clean and there's no smell of yeast in both ears. From this position I can check her mucous membrane and her capillary refill time just by lifting her lip up. I can see she's got nice pink gums and they're nice and moist. And the capillary refill time, good girl, is less than 2. So going down, I'm going to check for the lymph nodes. She's got some under her jaw, which is the submandibular lymph nodes. Got no other lumps and bumps. Checking further down, and she's got the prescapular lymph nodes at the front, and everything feels normal. Just check over her legs and her feet. Checking at her feet to make sure her claws are good, except for the dew claw, which we're going to remove later. She's got nothing, so sweet. There's no foul smell coming from them. There's no form of fungus. There's no sign of her chewing them. Come on, sweet. And down body, we check her spine, which is important with her being a dachshund. Everything feels good. Just checking for any general lumps, bumps that shouldn't be there, any form of discomfort in the dog, and she seems pretty happy. Back legs, she's got the pulse, you can feel the pulse point behind the leg. And same with her feet. And the back feet feel fine. You can feel the pulse point in front, just behind the front paw. She's got very dumpy paws, but you can actually feel the pulse point there. So now we're just going to listen to her heart and her lungs. For this, I'm going to do it by 15 seconds and times it by 4. The lungs are sounding clear, there's no crackle, there's no wheezing. Sounds like she's got good lungs, both top and bottom. I'm going to do her respiratory rate whilst I'm here. She's got a respiratory rate of 16. And for this, I'm just going to document this on our hospital shoe. just going to check her heart rate as well. Well, she's quite happy and relaxed, sat with us. Once again, I'm going to do this for 15 seconds and then I'm going to times it by 4. Stand up, sweetheart. She's got a heart rate of 122, which for a small dog it should be in between 110 and 140. So she's got a good heart rate and it's within limits. The respiratory rate should be between 10 and 30. Her respiratory rate was 16, so that's also within limits. We're going to check her temperature. Come on. For this, I'm just going to use some lubrication on the thermometer, just not to cause discomfort for the dog. Good girl. By doing this, I'm just inserting the thermometer into her anus and slightly lifting it upwards, so I'm not going into any form of feces, and I'm getting a true temperature of the dog. I've got a temperature there of 38.6, which is a good temperature for the dog at the moment. I've just recorded all my details on here, so when the next person comes they can check how she's doing and compare it to what I've previously wrote. And that's my video. Hi, I'm Maxine Higham. This is just a continuation with myself and Chloe that I've done the TPR for. The normal temperatures for the dog is 38.3 to 39.2, so she was within her range. Hi, I'm Maxine Higham. This is video 2. This is a continuation for just to clarify that the mucous membrane should be pink, which it was on Chloe, and the capillary refill time is meant to be less than 2 seconds, which it was on Chloe.